There she is. Hi, Kate.
Hi, how are you?
I'm doing well. I'm Kelly. I was just actually reading your bio and some information, and I was just sitting here, and I admit that I Googled a perineal massage because I'm like, how is it that I've had three babies and not one of my OBs ever mentioned the fact that you can do that to help your process go smoother? How is that? Something's fundamentally wrong with our system.
Well, my children are only 6 and 8 years old, and I was not told to do that either. So a friend of mine had suggested it, and I was like, "You
What?
do what now?
Yes.
Sorry, what?" And everything I had read had recommended that, like let your partner do it.
Oh, right, right. Yeah.
And that was even a bigger, like,
Yeah.
no.
Yeah.
No, he does not work with his hands.
Yeah.
He works with his brain. I don't trust that in any way, shape, or form.
You don't want this. Yes. No, I'm right there with you. I read a bit of what you have on your site and I was just cracking up. I love your writing style. And I was just like, oh my nuts. So clearly there's a lack. I was just
Oh,
clearly,
definitely.
and you're filling that gap, which is amazing. I was just chatting with some of the folks before you came on that this isn't just for pregnant women. It's about for
No,
all, because we all have a pelvic floor. And so I'm excited because every Tuesday I learn something. So I don't know if you're new
good.
to the Pelvic series, but it's something that, as you know, obviously Prince Lionheart is our family business, and
Yeah,
I realize that when it comes to raising children, we do the best we can based on what we know. Um,
right.
because we're all winging it. In fact, our
Yeah,
we provide our mission is to provide for life's grand improvisation, which is having children.
yeah,
Because you often get more help figuring out how to get married than you do having kids.
absolutely.
And so we started this several months ago, and it's been going great. Lots of
Good.
ask us questions in advance. For anyone joining, you can certainly ask questions live.
Hmm.
And it's just, we figure that when you know better, you do better. So it's all about tools in your toolbox.
I
So,
love that.
yeah,
That's great. Yeah,
I appreciate you joining us. I like to start, I read your kind of your bio, your profile. I thought it was hilarious, but oh so true. So maybe you
mm.
can just start by telling folks how you got your start to becoming kind of a Kegel release curve expert, but also just
Yes.
expert of the pelvic floor, which I'm
Yeah. Well, I've had children. I knew nothing about anything when I had children. And then I've been a physiotherapist for about 17 years now. And the clinic I used to work at, they had hired a pelvic floor physiotherapist.
mhm,
And she came in and did a sort of basically kind of what I'm going to do with you tonight is what we do, why it's important. And she started going through it. And I remember just like, nudging my colleague and was like, we
what?
do this? Like, we do internal exam, like, that's okay. The college lets us do this. And that was sort of, and this was after I'd had children.
Yeah.
So it was very new to me, and then started to learn a little bit more about it. Definitely. So I'm located in Toronto, Canada. And here in the province I live in, there is a big uptick of people understanding the need for pelvic physiotherapy and going through the certification process. So it was something I decided to do about 3.5 years ago. And I would say the most overwhelming thing I saw was just like, why don't we apply what we do in sports to the
Mhm.
vagina? Why don't we apply, like, why are we looking at this area any differently than we would like a knee surgery or an ankle surgery? And so I was like, let's do this.
Yeah.
So, yeah, that's kind of how I got my start.
Very cool. Well, it makes a lot of sense, and I commend you on your 11-pound 5-ounce baby. And I like that you mentioned your recovering vagina.
Yeah, yeah. I started a lot um, of this because I had a lot of the problems that people who had birthed were talking about. And I set some records at a hospital for how big my child was. And you know, I usually joke that my first child paved a highway out of me, and then my daughter kind of like slipped and slid out, and it was a much different experience. So
It's a highway through a mountain. Oh my. All right. Well, we are going to, as I said, this is general as well as baby specific, but
mm-hmm.
in general, as I said, I learn something every Tuesday that we do this. But in general, what do you want women to know about their pelvic floor?
Their pelvic floor is more than the stigmatized sexual organ that we have sort of thought it was. So it's either stigmatized and sexualized, or it's just for babies. And what
Right.
I think people need to understand is that your pelvic floor has five main functions. And to me, the more important ones are the ones that are really overlooked. And those functions are they support.
Mm-hmm.
So that group of muscles is like a hammock, and that hammock supports our pelvic organs. So our uterus, our bladder, our ovaries. So that's really important. Otherwise, these things would fall out of our body. So we need something to hold them. The pelvic floor muscles is the basement of our core, and that provides a lot of stability to your pelvic bony skeleton. So that's another reason. So we see a lot of pelvic floor issues when people have low back pain, and people don't make
Yeah.
this
True.
sort of association. So, you know, people with back pain, you might want to have, you might want to consider that aspect.
Mm-hmm.
It is for sex. It is also sphincteric, meaning that it squeezes. Sorry, I had laryngitis 3 weeks ago, so I have
It's
this little tiny Zoolander cough that I'm trying to hold back here.
oh, I have
Um,
8 weeks.
yeah. So the sphincteric, it means to squeeze. So
Mhm.
that means it holds in our pee and our poop. Massively important function.
Yeah.
Okay. And then the last one that people don't know about at all is it has a sump pump type of function. And what that means is a sump pump is something that you put in a flooded basement. It
Yeah.
takes the fluid out. Okay. So that actually has what we call a lymphatic function. And it's basically starting to help process out some of the excess fluid that our lower limbs tend to accumulate over the course of a day. So I always kind of laugh when you get on an airplane and it tells you to do like those gas pedals with your ankles and foot
Yeah.
pumps and squeeze your bum. You should actually contract your pelvic floor. And that would actually probably save your ankles from swelling more than just doing those gas pedals. But that's a much longer explanation on a little airport or airplane card. So yeah.
That's
So
interesting.
those are the major functions. And to me, it's just so much more than, you know, the very pigeonholed idea of, you know, it's for having a baby exit or for receiving something
Right.
sexually.
Okay. So so obviously for all of those reasons, pelvic health is important. Uh,
Mm-hmm.
because when it falls down, then you're going to have things kind of leaking, losing, not squeezing, not pumping, none of that. So, I mean, how do people come to know that they need to take care of this? Only when they have a problem and then they're told they need to do something?
That's typically right now where we're at. Yep. Um, and a lot of the time it's well and truly after those problems have started because, again, this area is a bit more stigmatized. It's not as openly discussed. And so a lot of the time, what we call catastrophize, right? So we have pain in that area, or we're having to go to the bathroom all the time, or maybe it's pain with intimacy, or we have leaks or incontinence, is what we call those accidental leaks. And we don't talk about it because
Yeah.
it's an embarrassing fact for most of us, right? Myself included. I don't want to pee my pants. I would have a hard time being like, oh, this happened.
Yeah.
So we kind of live with these symptoms, and then it's not usually we go to a doctor. It's a girlfriend or a sister or a sibling that we talk to about this, and then they may have the solution. They may say, you know, maybe go see your OBGYN, talk to your doctor. It is becoming more commonplace to talk to your pelvic physio, but that is even, it's still not as normal as we want it.
Right. So I remember going to my OB after I had the baby, and because I had a galactose in my breast, and she's like,
Okay.
once the baby's out, you're not mine anymore. And I'm like,
Yeah.
so where do I go now? Right. So do people, if they're experiencing these things and they're trying to find a doctor,
Mm-hmm.
even if they aren't pregnant, is the OB the right place to go?
So in Canada, your doctor would be a great place to start.
Okay.
Most of them should have base level knowledge of what would be normal or abnormal for symptoms. They
Okay.
may then recommend, based on a couple of questions, that they should be able to decipher whether or not this is a little bit more sinister, in which case you would want to see an an obstetrics or a gynecologist, basically.
Okay.
Sometimes a urologist. A lot
Okay.
of times urology, gynecology are linked. And so, and then more frequently, they are saying go see a pelvic floor physiotherapist. Physiotherapists in the States, occupational therapy is also is an avenue for people to see. They do have the scope of practice to be doing internal exams and still examining this area.
So occupational as opposed to physical in the States.
Yes, as I've been told, occupational does have this scope in the States. I've made the mistake online in my socials of only speaking about physios, and I had a very large group of American occupational therapists that were like, "Hey,
Up in
we're
arms.
over here. We can do this too."
Okay.
So yeah.
All right. Well, good to know. Okay. So women who are experiencing accidental leaks, and I presume that's probably a pretty common one, especially
Mm-hmm.
postpartum, but also just in life in general. Um,
Mm-hmm.
so you recommend for them to reach out or see, in my mind, and this is what I love about these Tuesdays because I get to take my, base knowledge. I would just start doing Kegels, right? And I don't even know if I do a Kegel correctly, but I try to flex those pelvic floor muscles. And I know a little bit more about my pelvis because I have had the lower back pain.
Yeah.
So that I can highlight the muscle, but that would be well, let me try
Yep.
this. Um,
Yep.
what more can you recommend to someone who's starting to leak?
So the thing with pelvic floor is, so Kegels, let's just talk about that for a second. So Kegels are named after Dr. Arnold Kegel, who was an obstetrician in the 50s. And he basically created an insertional device that measured how much pressure the pelvic floor, the muscles could contract on this. And he discerned that if you can get those muscles stronger, it will stop you from having these accidental leaks, that it was simply a strength thing. So this is a really rudimentary strength concept. And if we consider that, like, for the longest time, anyone who had knee pain, well, you should strengthen your knees,
Mm-hmm.
right? And that's not always the case, because what we have come to understand is that sometimes muscles are actually holding so much tension that they no longer have capacity.
Mm-hmm.
So it's that they're being held like this. And when you go to sneeze, cough, or laugh, and maybe that's what's causing your accidental leak, they have no more capacity to contract. They're at their limit. And so you're getting no more oomph out of these muscles to do anything.
Mm-hmm.
So, same with a knee. They have knee pain, and I could tell them to strengthen. But what I've actually, if I do a proper assessment, what I've discerned is that they have like no range of motion in that knee.
Mm-hmm.
And so those muscles are being held so tightly that without the range, they can't produce power.
Mm-hmm.
And so we've been told for so long that Kegels were the solution to all of our vaginal problems. And this is why the importance of having an assessment to sort of go, because some of your symptoms may lead me to think, you know what, you have too much tension.
Mm-hmm.
And just because you're having leaks, you could actually go, yes, they need to be stronger, or no, we need to like let them learn how to relax a little bit so that we can find the capacity for them to do their job when they're needed. A lot of times muscles are just like, they're so tired.
Right.
right? We know what that feels like. We know when we are tired that we are not strong.
Yeah, right.
And so sometimes the muscle needs to learn a little bit of TLC, a little bit of how to relax.
Hmm.
Sometimes it's actually going down and manually giving them a stretch, giving them the TLC. We were not taught by our parental units that like massaging your vagina is an okay thing,
Right.
right? But um, we massage every other part of our body
Yeah.
because those muscles are overused, tense, and they need to learn how to relax and get, even for the idea of blood flow,
Yeah.
right? We want the blood flow in that area. And when muscles are too tense, you're not getting that same amazing blood flow through them. And that helps with a lot of things. So I would say have an assessment
Yeah.
because we're pretty good, we're excellent actually, at discerning between are you in the too tight category? And I don't like using the word tight. I always say tense. Okay. Tight is sometimes a pre-programmed patriarchal concept of what it should be down there. So tight is not the desired effect.
Right.
Muscle, we don't want any part of our body to be tight, right? We don't want a shoulder that's tight.
Right.
We want a shoulder that is strong,
Hmm.
stable,
Hmm.
um, and knows how to work when we want it to work.
Yeah. Okay. So get an assessment. This is amazing to me that nobody's ever talked to me about a perineal massage.
Mm.
It makes so much
No,
sense. Um,
well, let's say you had neck problems, right?
yeah.
Your first go-to would maybe be just go have a neck massage, like have someone just loosen up those muscles because they're tense.
Yeah. It makes sense.
So same idea.
Yeah.
Something else about the tension that we're discovering in the body, specifically pandemic related, is that your pelvic floor is innervated by your central nervous system. And why that's important is that when it's in your central nervous, okay, so your jaw is central nervous, your neck, some of your neck musculature is central nervous. When it's those nerves, those are also fight or flight nerves.
Mhm.
And so emotion, stress, anxiety, like all of these types of things play into that system. So we've noticed, like if you talk to dentists, they will tell you how many mouth guards they've created because people have been grinding their teeth down.
Yeah.
And that's tension that we're holding in our jaw. And so what we don't realize is that if we're holding tension in our jaw, I would put money on the fact that you are holding tension in your pelvic floor, but we just don't know about it.
Right.
Or we're not as in tune and aware of
Right.
some of the symptoms that or sensations that we're having down there and what those all mean.
So speaking of the symptoms, so
Mm-hmm.
we know that, if you're starting to leak, go get an assessment. But what are some of the symptoms other than, kind of leaking? Is there anything that can be felt or of an unhealthy pelvic floor that kind of comes before you're actually cross that threshold into something that is,
Mm-hmm.
or what have you?
So I'll list a whole bunch.
Hmm.
So one of them would be your urgency to go to the bathroom.
Okay.
Okay, so you should be going to the bathroom about once every 2 hours, unless you have downed like a liter of water very quickly. So if you drink a lot and it seems like you're going to the bathroom proportionately to what you've drank, then that makes sense. If you're going to the bathroom every hour and you're only consuming about a cup of liquid, that's too often.
Hmm.
Okay, so urgency to go to the bathroom. The sensation of feeling like you can't get to the bathroom in time,
Mm.
right? So people will say, like, you get home, you put the key in the door, and it feels like you've got to go to the bathroom desperately. Okay, that is a software issue sometimes that our brains are programmed that it feels almost desperate. You get into the bathroom and it feels like you can't pull your pants down fast enough. That's another symptom because that's talking about the control that your muscles are feeling. Okay.
Hmm.
Um, Painful intimacy. Okay. Penetrative intimacy typically. Um, burning sensations. So feeling like you may have a urinary tract infection. So burning, tingling, pain that is outside of your menstrual cramps.
Mm-hmm.
So those types of things. Um, Feelings of heaviness. Okay, so this is more typical of postpartum people who are feeling heaviness, like something's pulling their pubic bones apart.
Mm-hmm.
That can be a symptom of what we call prolapse, which is that some of the structural integrity of your vagina is no longer holding up our pelvic organs, and we're getting a little bit of descent. Okay, so feelings of heaviness, low back problems, a lot of low back problems that you see massage, you see chiropractor, you see a physio, nothing is going away. Painful hip issues where you've seen everyone as well, and that hip is no longer, like it's just not getting better. There's a little muscle that you go around the corner of your pelvic floor, and if you get on that, sometimes that releases a hip better than anything else. Tailbone problems.
Wow.
So painful tailbone is 100% pelvic floor issue. Every pelvic floor muscle in the basement is attached to your tailbone. So a lot of the time people where they're feeling that tug or it feels like they can't sit for a long time,
Mm-hmm.
it's pelvic floor.
Men have pelvic floors too.
They absolutely have pelvic floors. They're almost identical other than the protruding part. Sorry?
I never even thought about that. Like it's always been women and Kegel and pelvic floors, right?
Yeah.
I've never heard pelvic floor in relation to a man, but they have them too.
They do. And where we see this probably the most is unfortunately men who've had certain cancers. So prostate cancer, bladder cancer, all of these will affect their pelvic floors. So we typically will see with men sort of like the post-trauma of the cancer, if there was treatment, if their prostate was removed, that definitely goes through some of the pelvic floor for the treatment and the surgical procedures. Cyclists sitting on a bike seat. So that's also when we see our men, men who've fallen on their tailbones,
Yeah.
men who have erectile dysfunction issues. These are definitely all related to some part of the musculature, either within their penis or in their pelvic floor. So again, they have their own stigma to some of their issues, and their issues and symptoms are a lot of the time silenced by their own sort of like, I'm going to call it insecurity, but just also like not understanding any of our pelvic anatomy.
Mm-hmm.
Right? We, unfortunately, in the schools, a lot of it is birds and the bees. It's kind of like how to have sex.
Right.
It's not, to me, and this is from my own upbringing and education, it's not taught from the perspective of this is a part of our body, it's anatomy, and it has function. We don't learn about all these other functions. We just learn about how to make the babies.
Right.
And there's a lot more to it.
Yeah. And preventive. I mean, it's never about that's kind of a thing.
Yeah. Yeah. And I, I think one of the things that I would love to advocate for is, and not just for my profession, but just from the perspective of understanding. But I do believe that if you are becoming sexually active, it does mean that your body is now being used. That is a workout on your pelvic floor. And that's kind of when I suggest that, maybe having, even if it's not from the internal exam perspective, but just from that, maybe it's a virtual assessment with a pelvic physio to sort of just learn about your anatomy, learn about some of the symptoms that can happen, learn about what can even happen if you do get a UTI, right? It's more than just antibiotics. Right? When the body sustains pain, it responds. It usually responds in a protective, guarded response, especially with that area. It's the most intimate area we have. So we're going to protect it. in a very quick and reactive type of response.
Right. All right. So talk to me about the KR curve.
Yeah.
Who created?
So basically, I could not reach my pelvic floor in any way, shape, or form when I was almost 8 months pregnant. Again, had the 11-pound baby.
Yeah.
So I was very large, and there's no chance I could have gotten my arm around that.
I was having a hard time going to the bathroom. I mean, it's like,
Yes, absolutely.
you need to help.
Right? Like wiping was like enough of a challenge. And so this is where, sort of the industry, the doulas, the midwives, the OBs, if they are recommending perineal massage, they're suggesting that your partner do it. The problem that I have with that, and I think that it can be a tremendously bonding experience, but my experience comes from a lot more of the sports background with rehabilitating post-surgical patients for total knee replacements, hip replacements, everything. And when I'm trying to regain range of motion for a patient, they are guarded towards me. I can haul on their knee as much as I want, but they usually have a better time of getting that range of motion back because they're in control. And to me, that's an incredibly important aspect of pelvic floor sort of perineal massage is feeling in control. Again, we talked about how protective and guarded it can be. And so even though your partner may have the best intentions to help you massage this area, what can happen is they go a little bit deeper in that massage. And immediately you go, ow. By the time you've said, ow, they respond. These are all milliseconds. But already now your pelvic floor is sort of like, ooh, we don't like that.
Mm-hmm.
And so it's guarded. And that becomes very counterintuitive. So I knew that pelvic wands existed. Pelvic wands are devices to get at trigger points a little more internally. I knew that those existed. I've worked in the sports area where we use a lot of stainless steel myofascial tools to sort of release a quad, release a hamstring, things like that. And so I wanted to create a pelvic floor wand that was casted out of stainless steel because I wanted the thermal effect. I wanted to be able to warm it up, cool it down. And so I went to brunch with my best friend, and I kind of told her that I had this idea. And at the time, she had just started dating an industrial designer.
Perfect.
And so I was kind of like, I have this idea, but I don't know. I was like, I don't even know how things are made. Like, how are products even, how do they come to be? And she's like, oh, you should talk to this guy I'm dating. And so I did. And he was like, oh, yeah, we could design that for you. Do you have like some specs? I was like, no. So that's how it started. And this is how it ended. So this is the Kegel release curve. We called it the Kegel release curve because kind of, as you asked so commonly, we know what a Kegel is. We've been told to do Kegels a lot. It's the solution to all of our problems. And what we've come to know is that we actually probably need to release that Kegel, that pelvic floor contraction, and learn how to relax that area a little bit more. And that's just even like in life. If you're stressed out, you'd be surprised how much tension you are holding down there. And if we're going to massage, every other part of our body when we get tense or sore, you run a marathon, you go for a massage after. When we're using it more, and that can just even be like a highly active sexual life, which is awesome.
Right.
These muscles are being used. And so a little TLC helps them sort of recover just like we would recover any other part of our body. And so, yeah, this is how it turned out.
Awesome. All right. And where is that available for anyone?
Yep. So it's on our website. We launched this during the pandemic. And so we're e-commerce. We had ideas to go retail and then retail all shut down. And so we've been doing great on e-commerce. And so we've decided to keep it that way right now. I've had a couple of people approach me locally, but yeah, it's not, people are very specific with when they need to use it. So having it on people's shelves are not actually as is not as common.
Right. So what's the website where people find it?
Yep, it's kegelreleasecurve.com.
Okay.
And or just krcurve.com is going to get you there as well.
Okay, cool. That's easy. Okay, so I talked about kind of this is applying to everyone. I didn't think we were going to go to, but so if a pregnant woman, at what point should she start paying attention to her perineal massage and or like right when she's thinking about conceiving or
so
and I'm guessing you can avoid the episiotomy, hopefully.
That's the goal, right? Is the goal is that we're trying to prevent any sort of perineal tears, any tears during labor, be it the doctor doing sort of an episiotomy or just baby coming out naturally and you'll have a tear. So the more pliable any tissue can be. And so I liken it to if I said to you, Kelly, like do the splits for me right now. You would probably hurt something, right? If I said, you've got 6 weeks to improve your splits, and I need you to practice a little bit every day, so that for the most part, we're not actually even necessarily stretching tissue. What we're doing is familiarizing our body with that position. A lot of the time, your brain is going to say, ooh, this is not good. And it really second guesses what the body's trying to do. But then as we familiarize positions, and you can see this in yoga practices, right? Those 30-day yoga, trainings, you'll see like, the one time, like they can barely get their foot over their head. And then like 30 days later, they're like, boom.
Yeah.
Right. And there's some extensibility and stretch that's happening, but more than anything, your body is starting to learn that like, that's an okay position for your body to be in. Right.
Sure.
And that's a lot of, we're trying to eliminate the protectiveness and the guarding. We're teaching our body how to relax. We are leaning into breath work so that can be a strategy for our body to relax, because when you're in pain, right, even like cold plunges are the latest trend, right? Hop in a like ice bath, but regulating your breath as soon as you get into that cold is a practice. Yeah. And that's what we're really trying to do with perineal massage is lean into some of the sensations that are going to be unwelcome during birth. Understanding that we can have some control over it. We can practice. So perineal massage typically doesn't start until about 32, 34 weeks. Sometimes I have patients who are having symptoms earlier, and I recommend it just from a blood flow perspective and not like a stretch. But pelvic floor for pregnant people, I would say, you definitely should wait past your first trimester and then go see a pelvic floor physio. Understand that you know how to contract that properly, right? How do you do a pelvic floor contraction, which is synonymous with a Kegel, and see them so that after you've had the baby, you know what you're going back to, because that's going to be part of the training so that we can recover and re-strengthen our pelvic floor a little bit quicker after to prevent some of these accidental leaks and other symptoms.
Right. Okay. It all makes sense. I mean, this is, again, my dumb question, but what do guys do for their pelvic?
So a pelvic floor contraction for men is pretty much identical to women. We use a lot of different cueing. So with women, we talk about picking up a blueberry and sucking it up inside. We use phrases like slurping a noodle. So if I am doing that with these lips, I want you to do them with those lips. Same thing. Gentlemen, sometimes actually telling gentlemen to hold in a fart is that gentlemen seem to understand. They give them that concept of being in an elevator surrounded by females. Right. Another fun one is pull the train back into the station. You can yeah, tons. So it's sort of different cueing, but conceptually and anatomically, the pelvic floor that we're trying to contract to get that lift is identical. It's just where it is more inside for females, and then obviously they have their protruding part that is a little bit different for us.
Wow, interesting. All right. Well, did we cover anything or not cover anything that you want to leave anyone with? And by the way, just for everyone joining us, I was reading through questions that we'd received in advance, but if you have any questions live, just shoot them out real quickly. We'll take a minute or two to answer them. Hopefully you've let go of the stigma, because there's no judgment here, and you've got a resource in Kate right here and now. I've learned so much. And so just so you know, you can shoot it in the comments, and then we'll go ahead and try to answer it. But Kate, anything that we didn't cover that you want to leave everyone with?
It is never too late. So I get this question all the time, and it comes up. And I even had a patient the other week who was like my kids are like 10 and 14. Like, is there any hope? And I'm like, and I go back to saying, well, that would be like telling me I've been having trouble walking. My legs feel a little bit wobbly. I guess I'm just destined for a wheelchair. No, right? We can always, even in our sort of like elderly population, we work on their balance. We work on their leg strength. We want to keep them mobile and ambulatory as long as possible. So same idea with your pelvic floor. It's a set of muscles. We can always train a set of muscles. So there's never any idea that it's too late.
Mm-hmm.
Even if you had a crazy birth, there's, we can rehab anything.
Okay. And not even birth related, but just incontinence as you age.
Yes, absolutely. Yeah. If you,
so it's either or not tight enough, but you guys, if you seek out the help of physio, you guys can assess and strengthen those muscles or release those muscles.
Exactly.
It's awesome. Super. All right. I am so glad. Hopefully we've done a little bit to remove the stigma around this muscle. We've just certainly enlightened me, like, oh yeah, that makes sense. It is just muscles, and we should care the way that we do any visible muscle, right?
Yep.
Makes sense.
Completely. Yeah.
Well, I appreciate it, Kate. You are on Instagram, and so remind me of your Instagram handle, for lack of a better word. I don't even know what they're called.
Yeah, I know, right? I sometimes only remember people as their handles, and I sometimes forget their first names. So the product is Kegel Release Curve, and that's the handle. And then myself as a physio, I'm Kate Roddy _6, the number IX physio. And 6 is sort of Drake's little nickname for the city of Toronto. So that's where we are.
Oh, cool. All right. Well, we appreciate your time. And for those
Thank you.
If you're interested in tuning into more Toolbox series, next Tuesday at 5:00 Pacific Standard Time, we have one about food allergies. And then going on December 13th, we have one backed by popular demand, is the Peaceful Parent Lisa Smith. And us all how to not lose our really shit as parents. So.
Oh, seriously.
I know. So maybe we'll wait.
I will tune in.
Well, appreciate your time. You guys have Thanks everyone for joining, and this will be posted.
Thanks so much.
We tend to dictate them on our site and create them as a blog post, and then we also put them on YouTube, and we'll share that and share it as well.
Awesome. Thank you so much.
Have
a good night.
Thanks, you too. Bye-bye.
Okay, bye.